I'm Berks County Commissioner Christian Leinbach, and I want to welcome you to another Berks County Commissioners Weekly COVID-19 update. The topics today are contact tracing and preparing to go to yellow with 4 of our local businesses. I want to not just welcome you, but welcome my colleagues, Commissioner Kevin Barnhart, Commissioner Michael Rivera, and I also want to take a moment to acknowledge the wonderful Berks County Information Systems team. They are the individuals that are behind the scenes that you don't see, that are actually producing this program. This program is being broadcast live versus via Microsoft Teams live event. It is also being picked up live by BCTV on their cable station. They are also running it live on bctv.org. And then we are also broadcasting live on Facebook Live and on YouTube Live, trying to get the message out to as many people as possible. Obviously, I think most people in Berks County are very aware of the fact that this Friday, Berks County moves from the red phase to the yellow phase. We're going to find out what it's meant to 4 businesses to deal with the red phase and what they are doing to prepare to be open or partially open. They'll tell you what open means for them in yellow, to protect their employees and to protect their customers. We're also going to hear before that from a panel talking about contact tracing, what it is, what it means, and dealing with some of the issues that people have raised, privacy, security, the fact that it's voluntary. So without any further ado, I want to move into the program, and I want to start by recognizing Commissioner Kevin Barnhart. He is chair of the election board and is going to give us a brief report on yesterday's 2020 primary election. Commissioner Barnhart.
Good afternoon, everyone. Thank you, Commissioner Leinbach. Yes, we went through our first COVID-19 primary and our first full-fledged mail-in ballot, and things went amazingly well. For the first time, we've had more ballots in paper returned than we had on the machines. So we had 39,036 ballots returned, hand ballots. Machine count was 38,130. So we had a 34% turnout, which is comparable to the 2012 presidential primary. The 2016 presidential primary was at 21%. So for an uncontested presidential primary, these were surprising numbers. So the ballots that were sent out were 47,000. We had 39 come back. That's about an 82% return. And anyone in business knows that's quite a return on your thing. So we've had a ton of people come in to help, not just our 11 dedicated workers in election services, but we've had other departments who had furloughed employees, dedicate people for the prior several weeks to help us orchestrate this election. They're still here today. They were here late last night. We're probably going to have the ballots scanned in for the most part this evening, of the 39,000 scanned into the optic scanners. And then the bigger issue is all of the election polling locations, 202, had provisional ballots. So if you sent your ballot in by mail or dropped it off, and you also voted provisional at the voting location because they wouldn't let you on the machine because the book said must vote provisional. So they will pull out that provisional ballot. They'll cross-reference that Kevin Barnhart mailed in a ballot and also went to his poll and voted, and they'll pull out that provisional, so I can't vote twice. Thanks to the 1,200 poll workers and the 300 new ones we had, based on a need because many of our poll workers are elderly and in that category of susceptible to COVID. So I want to thank everyone in the community. It was very peaceful. Things went very well, but it was awfully quiet at the polls yesterday. Thank you.
Thank you very much, Commissioner Barnhart, and thank you for your leadership with the election board. At this time, I'm going to turn it over to Commissioner Michael Rivera, and he's going to tell us about our partner, the Greater Reading Chamber Alliance, and the new reopening business certificate program. Commissioner Rivera.
Yes, thank you, Commissioner Leinbach. I wanted to share some very important information. The Greater Reading Chamber Alliance and the County of Berks have come together to do what's called Rebuilding Berks. And there's basically 3 parts to Rebuilding Berks. And the program focuses on Berks County's commitment to public health and safety and the county's commitment to restoring economic health to Berks County. So the first part of that will be another round of a small business loans or forgivable loans, and more information will be coming on that. But the second part, which I want to focus on more, is a workplace business readiness training program. And there's 3 parts to that. The first part is what Commissioner Leinbach spoke about, which is best practices for reopening your business certificate program. This is a free webinar series which is designed to help employers and business owners better prepare to reopen their businesses once Berks County moves to a yellow status. And it's a 3-day series, and the topics include overview of state guidelines going from red to yellow to green, workplace cleanliness best practices, human resources guidelines, returning to the office safely, legal issues, understanding litigation and liability issues, and supporting your workforce/employees to thrive. Each session is includes 2 45 minutes per topic, and there's different speakers coming in there, such as attorneys, business owners. It's basically experts in each area that will be talking on that area. And upon completion of the webinar series, your organization or business will receive the certificate of completion in best practices for reopening your business. And you can designate different employees from your company or your business to attend the different sessions if you have someone that focuses on the different areas. And you must have someone attending each of the 3 sessions to be able to get your certificate. The dates for the next round of classes will be Monday, June 15th, Tuesday, June 16th, and Wednesday, June 17th. And the classes will run from 1 p.m. to 2:30 p.m. If you want to register, you're able to register by going to the GRCA website, and registration will be open on Monday. So please, this is extremely important. The better prepared you are to open, the better it will be for your business. The second part of the readiness training program is other trainings that they will be performing, which are critical training and peer support for businesses in Berks. And the purpose of these trainings will be to provide businesses with the tools, programs, and services to jumpstart their operations. And again, these are free trainings through the remainder of 2020, no matter if you are a chamber member or not, because this is in partnership with the county. And the third part to it is peer-to-peer industry roundtables. And it's a series of roundtables for members and non-members, but these roundtables will include restaurants, professional services, environmental safety, manufacturing, and others. And here you'll be able to speak with business owners in these different areas and share best practices, share ideas, ask questions, and learn how you can help your business restart and grow the rest of 2020. Then there's 2 other strategies that we'll be working on. One is a buy local strategy, and this strategy will encourage consumer confidence in local retail, restaurant, and service organizations and establishments, and promote the importance and impact of supporting local businesses and products. And secondly, a Connect Local initiative, and this strategy will encourage the creation of local and regional supply chains in all business sectors, including agribusiness. And there will be a research component to link businesses with other businesses. So these are some important initiatives that the Greater Reading Chamber Alliance, GRCA, and the county are working on together to help our businesses be able to reopen safely, but not only to be able to reopen, but to be able to grow and to be able to thrive within this new economy that we're finding ourselves in. So if you have any questions, please reach out. You can also go to the GRCA website for more information, and also to sign up for the free webinar, which again starts on June 15th, 16th, and 17th. And one other thing before I finish up, if you are a store and you have a liquor license, the Liquor Control Board just set out some new guidelines for the outdoor dining that businesses are allowed, that restaurants are allowed to do now in the yellow phase. So please go to the PLCB website for more information, or you can reach out to my office as well. And tomorrow we'll be up on the Do Your Part Berks website as well, so you will be able to go there and get the information there as well. Thank you very much. That's all I have. And now Commissioner Leinbach, back to you.
Thank you very much, Commissioner Rivera. And just a note, the Rebuilding Berks website is greaterreading.org/rebuilding-Berks. greaterreading.org/rebuilding-Berks. Thank you very much. We're now going to go to the next segment of our program, and we have two speakers that will be talking about contact tracing. What is it? Why is it done? What is it? What are the issues that are important for our residents to understand about it? I want to note at this time, if you have questions, go to the Q&A area in your Microsoft Teams Live and post your question. Comments or questions must be germane to the topic being discussed. Right now, that will be on the contact tracing question. If you're from the media, list your name and the media you represent. If you're an individual resident, we're limiting you to one question, and you can ask a question of the contact tracing panel, as well as a question to the business owners. But please give us your name and your municipality where you reside. Mary Buer, my executive assistant, will read those questions when we get to the Q&A. Our first presenter is Dr. Ed Mahalik. Dr. Mahalik is the administrator for Berks County Mental Health and Developmental Disabilities, as well as the Berks County Area Agency on Aging. Welcome, Dr. Mahalik. You're muted, Dr. Mahalik.
There we go. Okay. Thank you, commissioners. Hit the button wrong. I'd like to thank you for the opportunity to talk about this and to discuss some of the details that I think are germane to the public in our community. Because as I've moved around the community in the past couple of weeks since we began working on this, there's a lot of misinformation and concern about there around the idea of confidentiality and the voluntary nature of contact tracing. Now, in a short while, I'll be introducing Carolyn Basic, the Executive Director of Coe County Wellness Services. First of all, Coe County Wellness Services is not new to our community. They've been here in the community for over 36 years. They have an excellent reputation, as does Carolyn, and an excellent working relationship with the Pennsylvania Department of Health. A little bit about history of contact tracing. It's the process of tracking down people who have been in close contact with someone who is infected with an infectious disease. It is not new to our country. It is not new to Pennsylvania, but I believe I'm finding out it's new to people in our community and worth spending some time about. During the 2003 SARS outbreak in the United States, contact tracing was one of the primary methods used to control the spread of that deadly respiratory illness. And it was also responsible for the eradication of smallpox in our country, which ended in 1979. Now, it manifests itself, the methods and processes of contact tracing, in different states. The public discourse today in many different states, including California, would lend some to believe, and many people to believe, that it occurs in the same way in every state, in every community. And I wish to point out some of the differences, not only here in Pennsylvania, particularly in Berks County, thanks to the initiative of the Board of Commissioners and our local agencies. First of all, it is completely confidential, as it is in every other place, but because we have made a decision here, and you as a Board of Commissioners have made the decision to initiate local oversight about it, that gives us a say in how this is going to move out. First of all, Co-County Wellness will be the agency that will be conducting the contact tracing after the initial contact with the Department of Health nurse. But then there will be two methods that we're able to employ. One is you will have local people, local volunteers and local staff for Co-County Wellness actually contacting people who voluntarily want to engage in contact tracing. There will be an alternative method for those people here in the county who would prefer not to talk to anyone. It's called the SARA Alert System, S-A-R-A, and SARA stands for Secure Monitoring and Reporting for Public Health. Either process that we use here in Berks County will be completely voluntary. After the initial call, if any resident of Berks County does not want to either talk to a person or participate in this completely technological endeavor with your phone where it actually contacts you via an application, you don't have to do it. You don't have to choose to enroll in SARA, nor do you have to choose to talk to anyone at Co-County Wellness. You can refuse to do that. Some states, there's a lot of discussion where apps are used that track your whereabouts and what you do. That is not what we're talking about here in Berks County in any remote way possible. And even if you use the SARA alert system, once the 14-day incubation period is over with, your information is completely erased from the system. It is not stored by any government agency or any nonprofit like Co-County Wellness. So a couple things to remember and take away. It's confidential. It is strictly voluntary. You can either choose to talk to a person or you can choose to use this notification system, much like our Code Red or other alerts the county has, to stay in touch with the system, get the support for what can for you and your family members and your loved ones, or you do not have to participate at all. So at this point, I'm going to introduce Carolyn Basic and ask her to get into some of the more specifics, and then we can entertain questions, because I know this is important to our communities. A lot of people in my neighborhood and my community have asked me questions about it, and there's a lot online on it, and there's a lot being bantered around in the country, but everything we hear out there doesn't necessarily apply here in Berks County. Carolyn?
Thank you, Dr. Mahalik, and thank you to the commissioners for having the foresight to engage in contact tracing for our community. A couple things to take note, and that is that I want to thank some people initially. Lindsay Malden, who's the Special Assistant to Secretary of Health, Dr. Rachel Levine in Harrisburg, and Jennifer Shirk, who is the Director of Community Health Systems Division of the Department of Health, have been working very closely in developing this partnership for Berks County with Co-County Wellness Services to move contact tracing forward. As Dr. Mahalik said, I think it's extremely important to realize, number one, it is a completely voluntary process. Number two, we will not at any point engage in using data tracking software on anyone's phone or computer or laptop. That is something that is being talked about. I believe it's even being talked about at the state level in Pennsylvania as a secondary method in some areas, but we will not be utilizing those methods here in Berks County. As Dr. Mahalik pointed out, we've been using contact tracing in the HIV epidemic, in SARS, in Ebola. It's a tried and true public health practice. Basically, what will happen going forward, and this has not been happening in our community to date with all of our positives, because the Department of Health is looking to partner with local agencies like Co-County Wellness Services to provide this important contact tracing service for communities across Pennsylvania, because they simply do not have the staffing at the Department of Health level to be able to do this directly from the state in every area. So when someone tests positive in Berks County or anywhere for COVID-19, because it is an infectious disease and it is a reportable condition, it's reported into a state database system. That information then comes to one of the local Department of Health nurses in our region. It will be the job of the Department of Health nurse to reach out to that positive case, talk to them about how they're feeling, what their symptoms are, and gather the names of people that they may have been in close contact with. And there's a special definition for that, and gather that information. That information is put into a SharePoint database that the state maintains, and that people who have passed a clearance at the Department of Health level and through Cook County Wellness Services, we will have access to that database. And it will be the job of the contact tracers to reach out to those people. At no point will anyone release the name of the COVID-19 patient, the positive case. That is a completely confidential set of information that would never be released to anyone. So the phone call would basically go something like, "Hi, we're calling from Cook County Wellness Services. We understand that you've been exposed, may have been exposed to someone who's tested positive for COVID-19. Here's things you need to look for. We would like to check up on you, and we would like you to quarantine for 14 days so that you potentially don't spread the disease to someone else." At that point, the person would offer them the option to enroll in SARA Alert, which Dr. Mahalik talked about, which is the secure monitoring and reporting for public health that the State Department of Health is using. That system would then, if the person says yes, we would say, "How would you like to be contacted? Would you like to be contacted by email, by text message, or by telephone?" We would enroll that person into SARA Alert, and for the next 14 days, SARA Alert would send that person a text message, ask them a series of questions that they could respond to, check up on them. If the person says, "No, I really don't want to be enrolled in SARA Alert, but it's okay if you call me every day to check on me," then one of our contact tracers would check in with that person. If the contact that we've reached out to says, "You know what, I really don't want to talk to you. I understand what you're telling me about COVID-19, but I really don't want to participate. I don't want anyone calling me. I don't want anyone bothering me," we would so note that in the system, and that person would not be called again. So again, it is completely voluntary, but the idea behind it is that when someone tests positive, when they have been exposed to a number of people, and they say the average positive person probably has been around 10 people, that if we could reach out to those folks and ask them to quarantine for 14 days, the likelihood that we can cut down on the spread of infection in our community is greatly enhanced. Commissioner Barnhart?
So Carolyn, hypothetically, I'm COVID positive, the nurse calls me and says, you've been out stores, work and stuff. How close do the people have to have been with me for what period of time? Like I'm gonna have to think back the last 2-3 days and say, who was I in contact with? How does that work? Do they give you a period of time to get back to them and say, I've been in contact with 12 people, here are their names, here's the best information I have. But I was also at the grocery store and I was in the express checkout aisle and I don't really know who I was in contact with.
So that's a great question, Commissioner. Thank you. If you've been exposed in a larger place, you were at the Giant or you were at Walmart, basically what they will do if there is someone who has tested positive and has relayed that they were there, first of all, you have to be relatively close to someone, closer than 6 feet, probably without a mask, and for longer than a 15-minute period to really potentially be at a high risk for having potentially passed your infection on. But what they do in many cases, now, first of all, for large environments like churches or the prison or nursing homes, if in those cases of positivity, the Department of Health is continuing to do the notification of those locations. But what routinely happens in a lot of communities, if there have been a number of people who have been in a place like Walmart, what they would do is notify the management of Walmart that between this hour and this hour on this particular day, several people in the store at that time have tested positive for COVID-19. And then they generally will reach out to the media and ask them to put a notice in the paper or to release on the radio that Several people who had been shopping at Walmart between this time and this time on this day have tested positive for COVID-19. If you were in the store at that time, it's possible that you may have been exposed to this virus. Please look for these symptoms. Call the Department of Health, call Cook County Wellness Services if you have a concern, and they'll do a general announcement like that, because it's virtually impossible to know as you're pumping gas at a gas station and might have been talking to somebody who was 3 feet away from you. You might not know who that person is. So they will try to put some general information out. And again, one of the common questions we get back is, well, people who are positive should know who they were around. So why can't they call everybody they were around themselves? Why do you need a contact tracer? Well, the reality is people are sometimes uncomfortable about disclosing that personal information. And so because of the level of confidentiality, it's one of the tools in the public health chest that really does help keep a community safe. And there's really some amazing information out there if you dig around about communities that have had robust contact tracing programs in place from the outset, how low their infection rates are compared to communities that have not had it. There was a great article in the New York Times about Paterson, New Jersey recently, and there's other data out there to support the fact that robust contact tracing really does help to control the spread of infectious disease.
Thank you very much.
I believe you're muted, Commissioner Leinbach.
I am. Mary Buer, if you could go ahead and read, I believe we have at least one question.
Yes, we do. From a Roar Stevenson from the Berks, excuse me. Can you go ahead and read it, Christian?
Yes, Rory Severinson, Berks WDB. I think that's a Workforce Development Board. What will the process be for volunteer recruitment, training, and expected length of service? Good question.
Great question. So I can tell you that typical of the Berks County community, and I've been in this community since I was a college student at Kutztown State College, so that will date myself because it was state college in those days, is a really wonderful community in terms of volunteerism and support and participation. And so since the article appeared in the paper and the news releases went out, we've gotten an overwhelming response. Probably more than 25 people have reached out already to volunteer. Our plan is to put together a combination of volunteers and a part-time paid staff that we will hire. We are asking our volunteers, people who are interested in volunteering, to reach out to us at ccws1@cocounty.org, or to call our office and leave a message for myself, Carolyn Basic, or Barbara Waller. Yes, sir.
You're muted, Commissioner Barnhart.
Yeah, okay, sorry. So if I volunteer, do I go through online training and have to go through a background check?
Yes, exactly. So every person, whether they're my paid staff people, part-time paid staff people, or volunteers, everyone must register with the Serve PA database in Harrisburg and select the Berks County Partnership managed by Cook County Wellness Services Group. Once a person is registered, you'll get the fact that you went through the registration process successfully. You get back an email a couple days later that says that you have been accepted. What that basically means is you've passed a background check at the state level and federal level. And at that point, Cook County Wellness Services, I had 10 of my staff trained by the Department of Health. Steve Kovaleski trained us, and we will be conducting our first training program on Monday for 10 people locally. And we will then be doing the training here of the volunteers. And we are asking for an 8-hour-a-week time commitment from the volunteers.
Okay, I see somebody with their hand up. You'll have to identify yourself and where you're from.
This is Amy Hendricks from Reading Dermatology.
Okay.
Yeah, I just had a question about how many people would need to be positive, let's say from Walmart or from Home Depot or something like this, that then that facility would need to maybe put out a news press. Is there a magic number?
I'm not sure. I think it's more the length of time the person might have been in the store in terms of how infectious they were and where they were in the store. But you'll see that, like, for example, what happened at the Wawa over on Lancaster Avenue. One of their employees tested positive. The store immediately shut down, went through a deep cleaning, and then reopened with staff from a different location because literally the staff at that store had to quarantine for the 14-day period because they were exposed to someone who was positive.
So that's a good question. If I'm someone that comes up in the contact tracing and I get a call and you say, Christian, we want to let you know that you came in contact with an individual and you should be quarantined for the next 14 days. What do I tell my boss? Is there something Cook County Wellness can provide that says, indeed, I'm not making this up, I was just called and told that I need to quarantine for 14 days?
Absolutely. The State Department of Health has something known as an order of quarantine, and every person that we call, we will email a copy of that order of quarantine. I know that sounds very official and very sort of threatening, but it's not meant to be. It's just basically just that. It's documentation that you have been notified by the Pennsylvania Department of Health that you have been exposed to someone with COVID-19, and it is in your best interest and everyone else's best interest for public health's sake for you to quarantine at home for 14 days.
Okay, any other questions? I'm looking at our outside questions. I don't see any. Commissioner Rivera has a question.
Yes, I have a question. Will you have contact tracers that speak Spanish as well?
Absolutely. Some of our staff, many of our staff are bilingual, bicultural, and we are specifically asking people to be bilingual and make sure that the teams are set up with an appropriate amount of folks who are bilingual. And at the same time, for folks who speak Vietnamese or some other language, we have a language link interpretation phone line that we can utilize in order to reach out to people in their appropriate language. Yes. Okay. So thank you for that.
Yep.
Very good. Any other questions? Very good. Thank you, Carolyn. Thank you, Dr. Ed. I appreciate that. And this is something, as I noted, will be available afterwards via our Facebook page and also our YouTube page. So I would encourage you to tag that link and share it to anyone that you may know.
Thank you very much.
We're going to continue with our agenda. As we have for the last several weeks, we are going to highlight 4 different businesses, all very different types of businesses in our community. And we want them to share with us the challenges that they faced under the shutdown and what they're doing as they prepare to open, and explain to us what open means to your particular business. I know it does not necessarily mean going back to normal, but I think it's so important to understand that we talk about businesses struggling and being in serious trouble, that we are able to put a face with these businesses in our community, and especially when we talk about small business. So our first presenter is Jerry Seidel. Jerry is the owner of Seidel Hyundai, and they're based in Shillington. Welcome, Jerry, to our weekly COVID-19 call.
Thank you so much. So I want to start with March 19th. The governor required us to close our sales department and keep our service departments open because we were deemed essential. On that particular day, we went from 42 employees down to 7 employees within an hour. We kept 1 office person, myself, a service manager, and 4 mechanics to help people with breakdowns. The first couple weeks were very tough. We were all very afraid of what we could get, what could happen. We took it amongst all the managers in the store to come up with a plan that if one of us got sick and we would have to shut down and get the place cleaned, who would come in, because those people will go down for 14 days. And fortunately for us, at this particular location, we did not have anyone that we knew or any family members or anybody come down with the COVID-19. So we were able to keep the same staff up until this Friday, when we can open with more staff in. So we continued to service cars and maintain the service customers. And as we went along, the days got easier. People got a little more familiar with what was going on. Customers were coming in with masks. We didn't need to ask them any longer to please put a mask on. We did absolutely no cash. We did every credit card transaction. The majority of the transactions we did over the phone. We put glass partitions in our office to separate the consumers from the office personnel that was working. Myself and my manager were separated from the mechanics. We separated the mechanics in 2 separate buildings so that we were not against one another constantly. I believe that helped us a whole lot. And then on obviously April 20th, we got word from the governor that we could go to notary sales, which required the dealership to do internet sales only. That doesn't mean that we were open to do test drives or greet customers or anything like that. At that point in time, we were able to do a full electronic deal. So the first day or two was very, very tough because most customers buying a $30,000 or a $40,000 car and giving us their information over the computer was not normal. Once we were able to educate the customers by the beginning of May, it got a little bit easier and the sales started flowing through, and we were able to start to sell some cars strictly on the internet, deliver the product to the customer's house, drop it off, and never make contact with the customer. We did everything online, everything electronically. It seemed to help us. However, we were missing that test drive with a customer. We did have to take a couple cars back because the people weren't happy with it. Set us back a little bit because we titled the car, obviously, and had to back that out with the Department of State being closed. We have some cars sitting around, obviously, that we don't have titles to right now. On this Friday, opening yellow means for us that we can now do a test drive, and that test drive is very, very important when somebody's buying a car and realize what they're getting. We can also do the paperwork in the store by appointment only. It doesn't mean our showrooms are going to be open and mobbed with customers. We're going to try and continue to do everything online that we can, bring the customer in, make sure the customer is okay with the deal that they got, educate them on what they purchased, how much they're paying, what their interest rate is, things like that. It will be one-on-one, fully masked, fully gloved, one person on one person, not husband, wife, kids. It will be one-on-one. If need be, and we do have these customers out there that have lease cars, and we do a lot of business with senior citizens. Obviously, we're not comfortable at all doing internet sales. We will bring them in one by one with half staff in our showroom, and obviously not even close to half fulfillment in the showroom. We'll also open our service lounge up, which holds about 30 people, and we're going to drop it down that we can only have 5 in that lounge at a time. We're doing pickup and delivery of customers' cars. When I say pickup and delivery, it does not mean we're meeting the customer at their house and picking their car up. We're asking them to put the key in the car. We drop a car at their house. It's not for them to drive. We drive their car over. We service their car, then we take it back and we disinfect the car when we get in it at their house, and we disinfect the car when we get it back to the shop. We're also disinfecting the building every single night. So every night we go home, the building gets the cleaning company to come in and disinfect it every night. We have disinfectant at every salesman's desk, every service rider's desk, every office. We have hand sanitizer in every department, at every desk, everywhere around the building. We do require our customers to wear a mask. If they come without one, we will offer them one. Obviously, we're not going to get into a severe confrontation with the customer that doesn't want to wear a mask, but we're going to explain to them that our employees are very important to us and you're very important to us. So we recommend that you wear the mask. If you don't want to wear the mask, unfortunately, we're going to have to turn you away. And we will do the deal on the internet if that's where you want to do it, but we cannot allow you in our building without a mask. I believe that the safety that we've learned in the building has saved us from anyone getting COVID, either any of our employees, and I have not heard from any of our customers that they received it from us, obviously, since we didn't have it. But we are disinfecting every car in the parking lot once a week, even if it's not test drive, to make sure it's still there. We had a company come in and disinfect the air vents in the building. So our air conditioning system and heating system was disinfected. And every single night we have the building redone. And I believe that we can handle customers properly and not spread the disease in any way, shape, or form. That's all I have. Thank you.
Thank you very much, Jerry. And as your ad campaign said some time ago, that sounded like a no bull answer right down the line.
Yes, it is. Yes, it is.
Very good job. We really appreciate the clarity that you provided, both on your experience with the shutdown, and it's got to be tough as a business owner to tell employees, I'm sorry, at least for now, there's not a job here for you. And I can't imagine, as a small business especially, to have to deal with that. But thank you, and stay tuned. We'll have some questions.
The day that I had to send those people home was devastating. And I got to tell you, if it would not be for the government extending the PPP, we'd probably not be in business today.
Wow. Well,
we appreciate that.
We're glad you're still in business and that you're being able to open up, not as in normal, hopefully not the new normal, but at least for right now, doing all the right things. So thank you very much. Our next presenter is in a completely different business. We go from an automobile dealer to a restaurant, Gracie's 21st Century Cafe in Pine Forge, and we have the owner, Gracie Skiatis, with us on the call. Gracie, tell us about your experience being closed down, what that was like, and what you're doing to prepare for Friday opening, what opening looks like for Gracie's 21st Century Cafe.
Well, we actually had a staff meeting today to go over the guidelines and rules that, and to parallel what the state has told us, but most of the things that we got from the state, we've already been practicing. We were permitted to do takeout service. We used compostable and recyclable materials in order to send the food out. Our kitchen is very small. We are not a large business. We seat only 40 people inside and can extend that to 30 on the outside. So it's just two of us in the kitchen with one young person who comes in to help, wearing masks, wearing gloves. The takeout business was a bit awe-giving to me. I was overwhelmed at the support that my clients and restaurant customers gave us through all that. It was a bit overwhelming. We were able to make payroll right up until last week. So though we had to let a few people go and they went on unemployment, but they're going to be coming back as of this Friday. It's been a struggle. Restaurants, most people don't know, work hand to mouth all the time. We are usually paying Peter to borrow from Paul and vice versa. So, you know, we're successful for 31 years here, and not that there's a lot of money, but we've paid our bills, and that, I'm told, is a big success in the restaurant business. So I'm very happy with what we've seen so far. Moving towards this Friday, we're going to do a very gentle, conscious opening. Guests have been requested to, we have this on our website, and we also use Constant Contact to reach out to our regular people. Our guests have been instructed to call us with their food order just as though they were taking it out to take home. We have purchased compostable and recyclable plates and forks that will be given out in a conscious way, but the food will be delivered to the table by the servers with their mask and their gloves in a bag, just like they were taking it home, at which time they can serve themselves at the table. The bar will be open, of course, and those drinks will be served in containers that have lids and are sealed, and we will provide ice and glasses for the people to use. My servers, my kitchen staff, people are very excited. My guests have been calling ongoing. My gosh, I'm so excited you're going to be open. It's just been really touching and an amazing acknowledgement of what we've developed here over these years, and we're so happy to get back online. It'll be a new normal, yes, but I am one of those cockeyed optimists who believe it's going to be a better way in the future.
Well, thank you very much, Gracie. Appreciate the perspective from a restaurant. And frankly, you raise a very important point that I don't know a lot of the general public are aware that at 100% capacity, restaurants have a very, very thin margin, and even under green. Right now, the rules show restaurants at 50% capacity when they are finally able to let people inside. I think that's something that has to really be looked at carefully, because if it isn't, I'm fearful we're going to lose a number of these small, local, family-owned restaurants that are gems in our community. So thank you very much.
And thank you for having me, and thank you to the commissioners for all their hard work, and the Cook County Wellness Group. They're amazing, amazing people, angels in our community, and thank you all for everything and the opportunity to speak our piece.
Thank you, Gracie. And now we're going to go to, again, a completely different type of business. This business is based in West Lawn, and it's Redding Dermatology. And our presenter is Amy Hendricks. She's a nurse practitioner and administrator with Redding Dermatology. Amy.
Yes, well, thank you also for, you've been getting a lot of thank yous, so that's always good, right? But thank you for having me as well. I mean, this has been really all we've all been thinking about as business owners. All we've been thinking about is how to open and when we're going to open, and we're so excited to do it. So to be able to share it is great. Yeah, everything, I mean, started back for us on March 9th, when that's when our facility, we kind of had an opportunity because we're in medicine. We saw what was happening, you know, as it started, and we started checking temperatures immediately and screening our patients immediately starting March 9th. And I think that helped us a lot because we see a lot of patients, and we have you know, a lot of staff within our office, and we started with that right away. And I think that was a really good plan. Yeah, March 16th, that's when we started reducing our schedules with our staff. And we went to just working, you know, 3 days trying to separate people from each other. And then very quickly by March 23rd, we knew right away that we weren't going to be seeing patients in the office, and that we needed to reduce to only urgent matters only. So we only saw emergencies. That was it, to try to keep people out of the emergency room and out of urgent care so that they wouldn't get COVID if they had, let's say, poison ivy, or they had a growth that was bleeding, or an ulcer that, you know, was causing them a problem. They wouldn't have to go to the emergency room. So we were open for those people. We did see patients on telemedicine, which was helpful. But if you've ever been to a dermatology practice, there's a lot of like touching and being able to look at something closely. It's hard on a screen to be able to do that. So it is a more challenging way of being able to really assess and do the best job that you can do. But listen, it worked for, you know, 2.5 months. But we're glad to be back at it. So as of, we also did get the payroll protection loan, which we were so grateful for. And we also really needed that because in our profession, it's interesting listening to the different industries, because we're different than the restaurant business and other businesses in that we actually don't get paid at the service. We get paid 3 months later from the insurance company. So, we actually wait for our fees to come through. So that we kind of had to plot that out within our budget to fit that all. And definitely the payroll protection loan helped us out tremendously. And I don't know what we would have done without that. So that has saved us. So as of May 11th, we started opening up very, very softly. So from March 9th to May 11th, the strategies hit in with what we were going to do and how we were going to open in a safe way. And so what it would look like now if you were to come into our business is you would call and make an appointment, and at that appointment you would be screened immediately with what maybe symptoms you might have, exposures that you've had, if you've traveled anywhere, the common things that you've already heard. If everything was good, then you would get an appointment. If you're a new patient, then a packet would be mailed out to you so that you could fill that out at home and then have that with you when you came into the office. Then when you get your confirmation call the day before, you get screened again. So you'll be asked the same questions all over again. So another opportunity to catch somebody if their symptoms change. And then when they come to the door, you're greeted right away by a nurse. And that nurse will take your temperature. She doesn't have to touch or anything. It's a temperature screener, that you just kind of hold up and it just scans the forehead and it gives an accurate temperature. She also will ask the same questions, and then she will also make sure that the mask is a mask that's appropriate. So on the phone, they're also told to make sure to bring a mask. So some masks are good masks and some masks might not be appropriate. Some masks might be as thin as a pantyhose, So then in that case, we would give that person a mask that would be good. Or if they didn't have one, then we would supply one for them. And then at that point, they would bypass the waiting room entirely. So that's how our whole industry has shifted, in that waiting room used to be something that you heard about and you were accepting that, okay, well, I just have to wait 5 minutes or 10 minutes before I go back to a room. Well, waiting room is a waste of square footage now, because basically what's going to happen now is you go straight back to an exam room, and that's where you wait for the doctor. So, and then when you're done with the doctor, you leave immediately. Now, when we don't have an exam room available at that moment, or there's somebody checking out, then what will happen is that nurse that's at the front that checks your temperature, she actually will give you a restaurant style pager, like what you get at Outback. And then you would take that to your car. And then we page you when we're ready for you to go to an exam room. So we've really streamlined the entire approach to, having something that is safe. If you're a patient in our office, you kind of feel like you're the only one there besides the staff. We have a full-time housekeeper right now. We always have actually, but right now she used to do things like, our business actually was very hospitality based. We had an open concept when you walked in, and there was brownies there, and there was water with lemon in it, and some coffee. It was very comfortable. Well, obviously that's shifted now. It's more, now we have more, everything has to be safe and clean, and nothing, can't have any of that fun stuff anymore, but that's just what people need right now. So we'll do what people need. So, we have the partitions up. We got the plastic partitions so that our receptionists are safe. We have X's on the floor in case somebody does need to speak with the receptionist, or if they need to check out and make an appointment at that time versus calling in. We just, I think we've done a really excellent job of keeping our staff and their families safe, and our patients and their families safe. We don't let people come with multiple people anymore, like multiple family members, unless they're under 18 or they need assistance. Then of course that's an exception, but so yeah, we've learned from this. There's lots to learn, but it would be good to be back to normal and this not to be the new normal, like I think everybody's been saying.
Well, thank you very much, Amy. Once again, somebody has, did you hear the echo? So, no. Okay, maybe it's just because it hears it. And no, there's some other people that hear it. You have to mute your system. So anyhow, Amy, I wanted to just share with you, you provided again another, this is probably not grammatically right, another unique example. Well, if it's another, then it's probably not unique. But anyhow, a unique scenario. You're the first entity I've heard explain to me that in lieu of waiting in the building, you give them a something like you get at Outback Steakhouse and sit in their car and wait till they're notified. Great use of technology that was readily available. So thank you very much, Amy. We have one more presenter today, and really Mark Wallace is representing a nonprofit. Everyone is familiar with Habitat for Humanity. They've been around for decades. They do great work in our community. We've been proud of the work, and I know as commissioners have had an opportunity to go out and see some of their projects, but not everyone is as aware of the Restore store in Muhlenberg Township. I believe you're almost next to where the Walmart store is there in Muhlenberg Township. And we have Mark Wallace. Mark Wallace is the manager, and he's going to tell us their experience with the shutdown and what opening looks like to them and how they're going to protect their employees and their customers. Welcome, Mark Wallace.
Thank you, Commissioner Leinbach, and all commissioners and everybody involved today, and to all the small businesses. Certainly want to wish you all the best in getting your businesses started. Yeah, as far as our location is concerned, and I found, I just started this position a few weeks ago as manager of the store, but I found that a lot of people have a general idea of where we're at. But yeah, we like to say we're between the Walmart and the Sam's Club, just behind the McDonald's. So you have all those big corporate entities surrounding us, but we're a big part here of Berks County and support in support of our mission and what we do with Habitat for Humanity. A lot of our funds for the operation for Habitat for Humanity and Tim Daly, our executive director, is generated here by the store, and we've been shut down since March 15th, Sunday, March 15th. I know Tim kept folks on payroll as long as he could, and then eventually had to furlough everybody. And fortunately for the staff, they all will be returning to work here at the Habitat for Humanity Restore, and we'll be opening our doors on Saturday, this coming Saturday, June 6th. At 9 a.m. And it's been a great response, because we've been here at the store getting it ready and cleaning it and doing all the necessary preparations. And I can't tell you how many folks are coming up and just peering through the windows and wondering when it's going to open. So hopefully with all those folks and everybody else, just wanting to get back to life as normal as possible, hope to see a lot of good folks here on Saturday. But our preparations, and like a lot of the other business owners have talked about, we are taking the necessary preparations to be ready to protect our customers, to protect our employees as well. And one of the big things that we're doing, we're having the electrostatic sanitizing services. They'll be coming out tomorrow night, and they'll spend a couple hours here in the store. And they're going to do a complete sanitizing of the store for us, and we're going to have them several times come out throughout the next few weeks to do that. We will have all the necessary masks. Again, as Jerry mentioned about his business, we will require all customers to be wearing masks. If you don't have one, we will have one for you. If there is some type of a need or you can't wear a mask, we'll be happy to take an order and present curbside service to you here, for your shopping needs. We'll have the dispenser stations with the hand sanitizers. We'll have all the proper markings on the floor to maintain social distancing. And I think a big thing, Commissioner Rivera, you mentioned this earlier, or asked the question, as far as the language, all of our signs for the COVID-19, as well as all of our store signs. They are being converted to both English and Spanish. We have a wonderful support from our Latino community here at the store. So we want to make sure that we're taking care of those language needs for both our English-speaking and our Spanish-speaking customers here in the store. Checkout, our cashier is bilingual. He will be behind plexiglass area. He will be wiping down that area continually. So we've created physical barriers that we call a tensa barrier, where people will get in line. They will have markings on the floor to maintain that social distancing of at least 6 feet. So we're excited about this opening. We're excited to get back to serving the community, and we are taking the necessary precautions and what needs to be to make sure all of our customers and our employees are safe during this time.
Thank you very much, Mark. And an interesting thing that I'm not sure everyone has thought about, we've talked in the past about small businesses that are competing with the big box stores that have never really been closed. And not only that, in reality, their business has been booming because there's been no other option for the small store. There's a double whammy with what you do. The Restore store is about a lot of used material, doors, building and supplies and materials. So one, people are being forced to buy brand new when they could come to a place like Restore and buy the material used. And two, you're being forced to compete against the big box store, the Home Depot and the Lowe's for things that you have readily available but weren't able to be open.
Yeah, it is kind of a double whammy, and I think all of our small businesses have to, the playing field is level when it comes to small business competing with, the big box stores. But one of the things that that got me involved here with Habitat for Humanity was back in January. I started working inventory procurement for Habitat for the Restore. And part of my responsibility is purchasing new items through liquidation. So I've been able to reach out to, some liquidators and be able to purchase brand new world market items. We'll have other brand name items that are brand new furniture items, appliances, things of that nature that we are gradually bringing into the store and changing kind of the look of the store in that sense. But we certainly are always going to have our donated items, and we get a lot of wonderful donated products from folks, not just from Berks, but throughout the area, who like to drop things off and come in and visit and see what we have to shop. And I want to let everybody know, when those items come into our store, they are all disinfected. The furniture items and things of that nature, we have to disinfect all those items, so they are taken care of once they are dropped off at the store, and our staff takes care of that disinfecting of those items.
Well, thank you very much, Mark, and thank you to all our presenters. We have several questions, but at this point in time, they all go back to contact tracing. And so we can get these answers, we're going to go ahead and I'm going to ask the question. The first one comes from Beth at Dancing Tree Creations Artisans Gallery and Studio in Boyertown. She says this: can small businesses help with contact tracing by asking customers to provide contact information in the unlikely event we are informed that someone who visited us tested positive, keeping such information confidential and for this purpose only, of course? Carolyn, would you like to jump in and answer that? I think Carolyn's still on.
Carolyn is on. I think
I am on, sir. How can I help
there
you?
Go.
Okay, you might have missed the question.
I did.
That's okay. This is from Beth in Boyertown. Can small businesses help with contact tracing by asking customers to provide contact information in the unlikely event we are informed that someone who visited us tested positive, keeping such information confidential and for this purpose only, of course?
That's a very good question, and I don't have a 100% answer at this point, but I will do my best to double check that with the Department of Health to see how they would want us to handle a situation like that, because I believe that they are still trying to manage any exposures that might take place in retail environments or larger areas. We're trying to reach out to people who have connections personally to people who are cases that are positive. But that's a very good question, and I have a meeting on Friday morning with the Southeast Regional Health staff, and so I will reach out to them to ask that question and find out, and I'll let you know.
Okay, so let's stay with you, Carolyn. This comes from Barbara Lopez. Barbara Lopez is the executive assistant to Commissioner Rivera. How will you find out who has been in contact with someone who is infected? What type of tracing will be used? Can we access this information online somewhere?
Basically, what will happen is, as I said, because COVID-19 is an infectious disease and it is reportable, it will be reported to the state database that you tested positive. So let's say, Commissioner Leinbach, you tested positive. Your positive test result and your information would be reported through NEDS to the State Department of Health. That information then would be transmitted to one of the nurses in the Southeast region to reach out to you and call you and say, have you heard from your healthcare provider? Do you realize you're positive for COVID-19? And they would talk to you about your host of symptoms. And then they would ask you, Commissioner, Christian, who have you been around in the last 2 days before you started symptoms? And they would ask you to provide that information to them. If you didn't have it readily available, they might ask you some questions to help, sort of spark your mind as to where you might have been or who you might have been around. And then they would ask you for that information, and if you had a way to contact those people. If you knew names but didn't know phone numbers, that would go to the Department of Health nurse, and then they would they have some tools at their disposal to try to get phone numbers for those people. That information gets put into a SharePoint database for our county that's available at the State Department of Health, which is why people need to go through the background checks in order to be cleared to have access to this. And they have to sign confidentiality agreements with the state and with us. And then our tracers would have that access and would start to call the people in that SharePoint database and offer them Sarah Alert or a daily call for their 14 days of quarantine. And they would issue those individuals that order of quarantine we talked about in case they needed it for an employer or someone else. So the general public would not have access to that information. That would only be accessible through a layer of password protected confidential steps that would be taken to people who are only authorized and cleared to get that information.
Okay, thank you. And one more question. This is also from Barbara, and Barbara, prepare to unmute because I'm not sure I understand this question. Maybe Carolyn will, since she's the expert and I'm not. What is the margin of miscommunication with this method of tracing? And then she went on and said, will it also be used on police, medical professionals, and pilots?
So basically, contact tracing, again, is a tried and true public health technique that's used to try to control the spread of infectious diseases. And so anyone who tests positive and is reported in the database, if it's a police officer, if it's a paramedic, if it's, the mayor, that information, once someone tests positive for that disease, goes into the database. And contact tracing is only as good as the information that you get from the people who are positive. So if I call you, Christian, and the Department of Health nurse calls you and says, you're positive for COVID-19, who have you been around now and in a couple of days prior to when you got sick? And you say to that Department of Health nurse, you know what? None of your business. I don't want to tell you that. Goodbye. And you hang up. there's really nothing that we can do to come after you to get that information. It's voluntary, and it's confidential. So the information is only as good as the information that we receive. But what we find is that with the right techniques and with talking to people, people don't want to make other people sick. You know, people
Right.
by and large want to do the right thing, and they want people to be able to be safe. And we all want the county to open safely, and we all want the county to get back to business as usual. This has been very hard on the non-for-profit community, the for-profit community. It's been hard on all of us to be in the state of shutdown for so long. And so by and large, if you can develop a rapport with people and talk to them, you know, contact tracing is really built on building trust. And, you know, one of the things I hope is that the reputation of Cook County Wellness Services over the last 35 years and our community is as an organization that people can trust. People know that we're here to help and to do the right thing, and they want to help. So, you know, margin of error, you know, is only as good as the information we get.
And one other addition to that, Carolyn, you may have mentioned this, so pardon me if you did. But so if Commissioner, I am the one of the people that you came in contact with, when one of the contact tracers contacts me, they do not tell me that it was you with whom I came in contact with. You are kept confidential, but they will say that Ed, you've been in contact with someone. They don't share that both ways. That doesn't cross either. So calling me, I'll have no idea that it was you, but I will have an idea that I was in contact with someone who may have been infected. So
right.
there are walls between each step of the process, and I think that's important to note.
Sure, and you know, and certainly I can't stop, you know, Commissioner Christian, you may have already called Ed and said, hey, I'm positive for COVID-19. I think you should stay home. But he may well know that it's you, and he may even try to tempt one of the tracers to say, oh, well, I know, my friend Christian called me. Well, you know, we can't confirm or deny that. We don't know. You know, we're just telling you that we know the Department of Health nurse listed you as a contact, potential contact, someone who has COVID-19.
And the tracer not only can't confirm or deny, they don't know it was you. They just know I was the person that you came in contact with. So even if they knew, they couldn't tell you because they don't know.
Right, and like I said, even again, they may need to know at some point just to be able to reach out or to reach back to the nurses to let them know that they were unable to contact with these people. But you know, everything is 100% confidential, voluntary, and secure. And we are not keeping, and like I said, the beauty of the Sarah alert system and this SharePoint system is that at the end of the quarantine period, that information is washed. It is not retained. It is not saved. It is not kept. It's not put in some secret database. It's gone. When you're out of quarantine, you're purged from those systems so that there is no long-standing records kept.
Well, thank you very much.
That has been true for all of the contact tracing that has been done for smallpox, for Sarah, for Ebola. I mean, that's just the way the program works. It's not meant to be an intrusive invasion of people's privacy. It's meant to hopefully keep them safe and healthy.
Well, thank you very much. I don't see any other questions online. Do we have any questions from our fellow commissioners? Anyone else on the call that you would like to ask specifically of our small business owners?
I just want to say this was a very informative media event, and I wanted to go back to Mark. I may have missed it. Are there specific hours to make donations at the Restore?
We have, we'll be taking donations this weekend, although I'm anticipating we're going to be a bit crowded. So ideally, if you can wait till next week, but usually Wednesday through Saturday, we go from 10 a.m. to 4:30 with drop-offs. And then on Sundays, we go from 1 p.m. to 4:30. We have suspended our pickups at homes, at least for the next 2 months, and again, primarily as a precaution, but we still will be.
Okay, I'm back again.
Here.
Yeah, I'm back now. Sorry.
Good. Thank you.
Earpiece in one ear and phone in another ear. It's just crazy.
So
Crazy time.
Okay, hang on.
Thank you, Mark.
Okay.
Any other questions?
I have a question.
Yes, Michael.
Yeah, for one of the business owners and one or however would want to answer, just wondering, and first of all, let me thank you for what you're doing to keep your clients and your employees safe. I know based on everything that you're saying, there's a lot more overhead, a lot more time that goes into everyone's work, and that means less revenue for the business. But at this time, I thank you for looking at the employees and the client safety first before revenue. So my question is, have you determined what the revenue of your regular sales would look like versus what your sales now will look like while we're still in this COVID mode, if you would want to put it that way?
Who wants to jump in and answer that?
It's Jerry Seidel. I believe we're going to be about 75% of what we normally did in the month of May and June.
Wow. And Jerry, the car business, at least my experience has been, you track how many units you're selling every single month. It's competition among your sales folks, but competition between you and other Hyundai dealers and other car dealers. You can't survive very long, 75% decline month over month.
No, and that was, so we just closed our month of May, and we were 75% of what we normally did. And I believe June is probably because we probably won't go green anytime in June. I believe June will also be about the same as May, maybe a tiny bit better, but I don't think so.
Wow. Yeah, and a car's a big purchase, Jerry. So you have a lot of people out there that while they may be on unemployment, they may not know for certain whether they have a job to go back to. So it makes it harder to make these bigger purchases.
Correct. And I believe it's going to be a little tough in June as well as May, because I think people are going to get a better feel when their unemployment, the $600 runs out in July, and they'll have a better understanding if they have a job or they don't have a job.
Wow.
And apart from reduced sales, also then you have the added expense of having someone go pick up the cars, bring the cars back, take them back, all the extra cleaning and everything else that goes into it as well.
Yep. It's going to be a couple tough months, but I do see light at the end of the tunnel. There is pent-up demand. It will come, and customers are going to need cars. So I think by August, maybe late July, August, we'll be back to normal.
Great.
Boy, we all certainly hope that we can be back to normal by then, whatever normal looks like. Gracie or Amy, can you share any information on your month-to-month revenue decline?
Yeah, I mean, we're at Reading Dermatology, we're about 50%. We're about half of what we were. And that's not because we don't have the clientele. Actually, people are trying to get in because they're worried that they might lose their insurance, but we, are walking a tightrope of trying to see people. We have a backlog of people that need to get in, but then we're walking the tightrope of trying to see them safely, and in a very controlled manner. And so, we almost need more staff to be able to orchestrate that, but yet that costs more money, So really to be able to see, and meet the needs of what we need right now with the community and the backlog that we have now 3 months, behind, we almost need more staff for that, but we know we're not gonna have the revenue for it because we're half of what we are. So yeah, kind of between a rock and a hard place for sure.
Well, I want to thank everyone on the call. I think Gracie got off the call. I know she has a very small operation there. I've been to Gracie's, and great place to go. We wish you all the very best as you prepare to go to another level of opening, and really appreciate you taking the time to be on the call. Carolyn and Dr. Ed, we appreciate your expertise relative to the contact tracing. And I want to give my colleagues an opportunity. Commissioner Barnhart, Commissioner Rivera, any closing comments?
No, I just will have more accurate updates on the results of the election tomorrow for our commissioners meeting.
Very good. And since you brought up the commissioners meeting, people can tune in 10 o'clock tomorrow morning. You can go to the Microsoft Teams live link, and you find that by going to countyofberks.com, and in the upper right hand corner there is a button that links to our public meetings, and you'll find the link at that location. Tune in, and Commissioner Barnhart will give you an update on the elections, maybe some final results that we might have. Unofficial yes. Results. Commissioner Rivera.
I just want to thank Dr. Ed and Carolyn for being on the call and sharing the information around contact tracing. We've been receiving various emails and calls in reference to that. So thank you for all the clarification in that aspect. And also to Jerry, Gracie, Amy, and Mark, thank you for all that you're doing, again, to protect your employees and your clients as well. And I wish you the best in your businesses, and looking forward to getting through this and getting out of the green as well, because it's not just a matter of getting to green, but getting out of green as well to get back to some type of normalcy. So thank you for all you do, and if there's anything I can ever help out with, let me know.
Thank you, commissioners. As we close, two reminders. One, please utilize all the resources that we have available on doyourpartberks.com. This is a courtesy of the County of Berks, providing you with information and resources as both businesses and individuals to help you do what you can to help stop the spread, and resources about opening your business safely, and as an individual, how to act appropriate and safely in our community. Secondly, I want to note that effective end of day Friday, the Berks County COVID-19 Help Center will be closing. We've been monitoring on a daily basis the utilization of the Help Center. The numbers over the last couple of weeks have dropped gradually, but they're at a point where we can't justify keeping the center open 5 days a week. We will continue to monitor the email, and that email is covid@countyofberks.com. If you have questions about COVID-19, business, individual, or otherwise, please feel free to email us at covid@countyofberks.com. Thank you again for joining us on our weekly COVID-19 update. God bless and be safe.